Infection Herbs Botanical Medicine Tutorial. Artemisia annua belongs to the Asteraceae family, also known as sweet wormwood or annual wormwood. Artemisia is a bitter. It is a powerful antimalarial. It is a powerful antimicrobial, having both antiviral, antibacterial, and antifungal activities. It was first mentioned in 168 BC in traditional Chinese medicine, used to clear summer heat, cool the blood. It is 90% effective for malaria infections, better than chloroquine, and active against chloroquine-resistant strains. Used also for prevention of malaria, cancer, especially leukemia and colon cancer. It is the active constituent. The bitter is artemisinin, which is the sesquiterpene lactone, and that is the ingredient that is effective, or the active constituent, against malaria. It is the leaves that are used, and most of the leaves now are farmed in preparation for malaria-resistant sort of vaccines and drugs. Next is Baptisia tinctoria, one of the most powerful alteratives used traditionally by the eclectics. Belongs to the Fabiaceae family, also known as wild indigo, yellow indigo, indigo broom. It is an immunostimulant. It has antimicrobial properties. It is a febrifuge. As aforementioned, it has powerful alterative properties. Baptisia is traditionally now used for focused infections, infections of the upper respiratory tract. It is combined with other botanicals such as Articum lapa or Echinacea in terms for chronic viral infections, or with Echinacea for chronic fatigue and constipation. It is the root and the leaves which are used. The alkaloid constituent is baptidotoxin, and it has genistein, which is an isoflavone. Contraindications include hyperemia, which is empirical, pregnancy, which is speculative, and prolonged use is not typically suggested unless under the watchful eye of a skilled practitioner or herbalist. Cinchona, also known as Jesuit bark or Peruvian bark, belongs to the Rubiaceae family. Jesuit bark has been used for hundreds of years for fever and the treatment of malaria, including chloroquine-resistant strains of malaria. It can be used for infections, digestive weakness, sore throats, muscle spasms, arthritis. It is a bitter tonic. It is an antimalarial, as aforementioned. It is antibacterial. It has antiarrhythmic properties. It is a cardiac depressant, a negative chronotropic in terms of cardiovascular function, and an astringent. It is the bark which is used. The alkaloid which is active is the quinine. It is prepared typically as a tincture or as a decoction. Contraindications include pregnancy due to the issues with the possible teratogenic components within the chemicals, lactation, and in cinchonism or prolonged use, acute inflammation can occur, including nervous or vascular irritation. Hypericum perforatum or St. John's wort belongs to the Hyperaceae family. St. John's wort is a classic anxiolytic or nervine. It is a vulnerary. It's an anti-inflammatory. It's used as homeopathic preparations for nerve pain. It is a powerful antidepressant, inhibiting serotonin uptake at postsynaptic receptors. It has antiviral and antibacterial activities, and it is a liver and gallbladder tonic. The active constituents are hypericin and pseudohypericin, as well as hyperforin. The parts used are the flowering tops. It is typically prepared as tincture or as a powdered supplement. There are empirical references for it being contraindicated in pregnancy. Also, it is not typically recommended in severe or endogenous depression or depression with suicidal risk. Larica tridentata, also known as chaparral, is a medicinal herb, or the creosote bush. It belongs to the Zygophyllaceae family. Larica tridentata is, or creosote bush, has anti-cancer properties, antiseptic. It is an alterative. The Nor-dihydroguariatic acid, or NDGA, which is the main metabolite in the creosote bush, has been shown to have promising applications in the treatment of things like cardiovascular disease, neurological disorders, and cancers. And as aforementioned, it's the NDGA, which is the main metabolite, is the aerial parts which are used. Ligusticum porteri belongs to the Apiaceae family. It is a species at risk found in western North America. It is considered a sacred herb of the First Nations people of the Rocky Mountains, burned as incense for purification. It used to induce sweating before purification rites and sweat lodge, used by most Native American medical practitioners for a variety of chronic and severe infectious diseases, particularly those of viral origin. Contains numerous antiviral, antimicrobial constituents. It is used traditionally now for upper and lower respiratory tract infections. It has powerful antiviral components against HPV and HIV, does promote menses and induce sweating. It is contraindicated in pregnancy in large doses. Lomatium dissectum, also known as Indian balsam or lomatium, it is part of the Apiaceae or the Umbelliferae family. It is an antiviral and antibacterial. It is the roots which are used. It is also an antifungal and has fungicidal activities. Lomatium is overall useful in acute and chronic viral, bacterial, and fungal infections, as well as other inflammatory disorders of the respiratory system. It is contraindicated in pregnancy, although this is speculative, due to the uterine relaxant coumarins found in lomatium. Also, the coumarins, the furanocoumarins, can induce photosensitization to those who are susceptible to that. Parts used are the roots, and it has, as aforementioned, coumarins, saponins, proteins, methylamine, valeric acid, oils and resins of the terpenes and the sesquiterpenes. Melaleuca alternifolia, or tea tree, belongs to the Myrtaceae family. Tea tree is a very powerful antimicrobial against fungus, bacteria, viruses. It has antiparasitic activities. It is an immunostimulant. It is a classic antiseptic, and it is an ideal antiseptic and disinfectant for skin and skin conditions, including rashes, wounds, impetigo, dermatitis, warts, fungi. Can be used as for orally as a gargle. Internal uses can also be used as a water infusion, and typically as an oil. It will be typically put in with another oil. It is the terpene 4-ol, which is the principal constituent, and it is a volatile oil. Olea europaea, or the olive tree, belongs to the Oleaceae family. The olive tree is the cornerstone of the Mediterranean diet. It is cardioprotective. It is antimicrobial. The leaves are used, the fruit, the olive oil, and the flowers, the latter in terms of Bach flower essences. It is oleic acid is the principal constituent in the oil, along with polyphenols. In the leaves, you have oleonilic acid and all of the other constituents that go along with that. Again, the oil is cardioprotective, hypotensive, hypocholesterolemic. It is a vasodilator. It has antiarrhythmic effects. The leaves are also hypotensive, also improve circulatory function. They are a diuretic. They have hypoglycemic. They are also antioxidant, antipyretic, antifungal, and antiparasitic. Tabibua avellanedea, otherwise known as pau d'arco, belongs to the Bogoniaceae family. Native South Americans considered pau d'arco, the tree, a cure-all. Used it for wounds, skin diseases, snake bites, fever, malaria, intestinal problems, dysentery, ulcers, you name it. It has antimicrobial activities, the lapachol, antifungal, the beta-lapachone, antiviral, antiparasitic, antineoplastic. Constituents, naphthoquinones, including lapachol as aforementioned. The beta-lapachone is the bark, especially the inner bark, which contains most of these constituents, the hardwood and the leaves. It is contraindicated in pregnancy due to the teratogenicity of the lapachol, which has been found in